Eating nuts, such as tree nuts like these almonds, can have a marked effect on heart health. Photo Getty Padraic Flanagan. One day, Monday, November 13, 2017. Eating a variety of nuts at least twice a week cuts the risk of heart disease by almost a quarter, new scientific research suggests. The study, published in the Journal of the American College of Cardiology, shows that regularly consuming a handful of different nuts provides significant protection against the world's biggest killer. Researchers found that eating walnuts, peanuts and tree nuts such as cashews, almonds, pistachios, almonds and Brazil nuts had a markedly positive effect on heart health compared to the results for those who rarely or never ate nuts. The study looked at over 210,000 people working in the U.S. health professions over a 32-year period and was led by Dr. Marta Guashfair, a nutritionist at Harvard University in Boston. She found that those who ate any of these tree nuts 2 or more times a week were 23 and 15% less likely to develop coronary heart disease or cardiovascular disease, including strokes and high blood pressure, respectively. The same amount of peanuts, which are classed as a legume, also reduced the risk of the conditions by 15 and 13%, respectively. Eating walnuts 1 or more times per week reduced coronary heart disease and cardiovascular disease risk by 21 and 19%. Dr. Guashfair said the study, the largest ever to look at the frequency of nut consumption and its link to cardiovascular disease, strengthened the reputation of nuts as a superfood. Our findings support recommendations of increasing the intake of a variety of nuts, as part of healthy dietary patterns, to reduce the risk of chronic disease in the general populations, she said. Her analysis of the large-scale study showed a consistent link between the quantities of nuts consumed and cardiovascular disease and coronary heart disease. Those who ate 5 or more servings of nuts a week had a 14% lower risk of cardiovascular disease and a 20% lower risk of coronary heart disease. The results were similar for tree nuts and peanuts individually. Eating peanuts and walnuts was also found to reduce the risk of stroke. Dr. Amelia Ros, of the Endocrinology and Nutrition Service at the hospital clinic in Barcelona, in an editorial for the journal said the results suggest nuts really do protect against heart disease. Capsules, he said. Raw nuts, if possible unpeeled and otherwise unprocessed, may be considered as natural health capsules that can be easily incorporated into any heart-protective diet to further cardiovascular well-being and promote healthy aging. Our findings support recommendations of increasing the intake of a variety of nuts, as part of healthy dietary patterns, to reduce the risk of chronic disease in the general populations. Cardiovascular diseases include conditions such as heart disease and strokes, which involve reduced blood flow to the heart, brain or body due to a blockage or narrowing of the arteries. Coronary heart disease is when fatty plaque builds up in the walls of the coronary arteries. It affects 2.3 million people in Britain and causes 69,000 fatal heart attacks each year. In news, http://sinews.co.uk